normal appendix and inflamed appendix. What is the features of inflammation? What are the 5 important features of inflammation? Cardinal signs of inflammation. Loss of function, redness, good, swelling, pain, good. So now you can see this, and it's swollen. Is swollen, this one? Swelling, one thing. Second, of course, this will appear more redness. Third is gives the pain. Appendix, when the patient develops severe pain at all. Loss of function, and then increased temperature. More. These are the 5 cardinal features. Can you see some feature here?
You can see the
So we can see hyperemia, we can see swelling. These 2 features. So this means out of these, which one is inflamed? This one is inflamed. Now inflammations are different types, acute and chronic. What cells are present in acute and what cells are present in chronic? Neutrophils in the acute, monocytes in the chronic, very good, or lymphocytes in the chronic. Now, what is the difference between neutrophil and lymphocyte? How you can see?
nuclear.
Yes, nuclei. In the nuclei, if there are more than 2 lobes, this is a neutrophil. If only 1 lobe, lymphocyte. If it is very large, become monocyte. Okay. Now if you see the cells with different lobes, like 1 and 2 lobes, 1, 2 and 3 lobes, so these will be neutrophils. So when the neutrophils are present in the appendix, mean acute appendicitis or acute inflammation. This one is open. So now you can see the neutrophils, 1, 2 and 3 lobes. So this means this will be acute inflammation. So most important cell in acute inflammation is neutrophils. Okay, now this is basically lungs. This is normal lungs. Normal lungs contains air, but here if you see all neutrophils, now you can see 1, 2, 3 lobes. So when there are more than 2 lobes, this is a neutrophil. Okay, so if you find neutrophils, this will be acute inflammation. Then chronic inflammation, again 2 types. One is specific and one is non-specific. Non-specific mean when there is granulomas. Granuloma is a specific chronic inflammation. There are different causes of granuloma. Non-specific mean other cells. What are the cells which are important in chronic inflammation? You said lymphocyte. Then there is one monocytes, which is a macrophage. Then sometime lymphocytes become converted into another cell. Do you remember the name of this cell?
Giant cells.
No, giant cell, okay, this is from
Again.
sometime the lymphocytes are B lymphocyte, T lymphocyte. B lymphocytes sometimes become another type of cells. Yes, which produce antibodies. They are known as plasma cells. So in chronic inflammation, you will find lymphocyte, you will find plasma cells, you will find macrophages. Now we will see. Okay, the plasma cells, if you see, okay, which one? Okay, now you see the cells, single nucleus. See the cells, single nucleus. Here, nucleus on one side, cytoplasm on other side. This will be a plasma cell. If nucleus, only nucleus, like this only nucleus, this will be a lymphocyte. If the very large cell containing cytoplasm, this will be a macrophage. So the same size, so the most important is nucleus becomes on one side and cytoplasm becomes on one side. This is again plasma cell which is derived from B lymphocytes. Okay, and this is a feature of chronic inflammation. Lymphocytes, plasma cells and macrophages are features of chronic inflammation. Now, if you find this granuloma, this is again chronic inflammation, but this is a special type of chronic inflammation because it has certain specific causes. One of the important features is giant cells. If you see the giant cell like a horseshoe, like periphery placed, nuclei are placed at the periphery. So these are typically known as Langhans type giant cells, usually found in which infection?
Chronic.
In tuberculosis.
Oh, sorry.
Granulomas can be because of tuberculosis, can be because of fungus, can be because of parasite, many causes. But one of the important ones. Okay, so these are Langhans type giant cells, which are usually found nuclei at the periphery. Okay, So this is not good one, this one is good. If the nuclei are all around, then we call them as foreign body type germ cells. Okay. Okay, maybe from this one. Here this is a foreign body, and nuclei are just haphazardly arranged, not properly arranged. If they are properly arranged, this is Langham type, which is usually in the tuberculosis. If they are improperly arranged, this is basically foreign body. Any foreign body, like any suture, anything which comes in the body, they will make this. This is a foreign body type germ cells. Now, if you see, these are nuclei are peripherally arranged giant cells. This is a necrosis, which is a basically caseous necrosis. So caseous necrosis with this type of giant cells, most important cause is tuberculosis. Caseous necrosis always occurs in tuberculosis. Langham type giant cells are also occur in tuberculosis. You find two things. So this will be a typically granulomatous. We call it as chronic granulomatous inflammation. Now it contains caseous necrosis as well as Langham type giant cells. Most important cause will be tuberculosis. This is what type of giant cell this is? Foreign body type giant cells. Now this is the granulation tissue. This was a wound and now it's healing. When the granulation tissue become more red, it contains two important things. One thing is many vessels. And second thing, they contains fibroblast. So proliferation of fibroblast and many new vascularization. Two things that is known as granulation tissue formation. Then the wound is healing in stage. Okay, this is an ulcer. Ulcer is like a loss, like this is normal, here it is lost, and then again. So this area is known as ulcer, when there's something is lost. Like the skin, if you damage it, its loss is ulcer. Most commonly ulcers occurs in the GIT, gastrointestinal tract. Any ulcer, you know, stomach ulcers, very common ulcers, known as peptic ulcers. In gum ulcers can occur.
Also, ulcer on the skin.
Skin, yes. Yes. Mouth, many areas. So most commonly it is a GIT, gastrointestinal tract, which is most affected by these ulcers. Okay. Now, when the healing occurs, if you see if there is a wound, then granulation tissue formation, then fibrous tissue healing will occur. If healing occurs more, so then it becomes keloid. So keloid means more fibrous tissue. So healing which is abnormal. As we discussed, the things which are in normal amount are normal. If they are in abnormal amount, even they are good, they become bad. So this is abnormal healing. What is abnormal healing? Keloid formation. Excessive collagen formation. Okay, so we can go again. Can you identify this cell?
Plasma cell.